Hello, welcome to the eighth module of PHM 601. And for this module, we'll be discussing population health workforce. And there are three learning objectives. In the first one, we are going to discuss the role of the workforce towards achieving population health strategies, and then describing the roles and functions of, workforce development, and then finally, managing change towards achieving population health goals. So, within the health ecosystem, there are a lot of key players that are working in there, and some of them are working as the workforce or and they are doing this in different capacity. We have the clinical work staff, we have public health agencies and professionals, and then we have the social workers, and then of course we have the financiers and the payers like the insurance companies and stuff. So there are so many people with various competencies and various trainings and various skills that are working in the healthcare ecosystem and are at least try to work towards a common goal, which is to improve the health of the population. And so you can find that with all of these people working towards this goal, there's to a degree some form of synergy that kind of has to happen if that is going to if we're going to achieve this goal of improving the health of the population, whichever population it is that we are focused on, and some of that will require that there's expansion in terms of expertise. We scale up in terms of delivering services to more people than was initially done, or sometimes it could be in creating or supporting innovations. So there's a lot of moving parts when it comes to the health workforce. So what is very very important to consider in as a, let's use for example, you are a program manager and you are trying to find the right people for the role that you're trying to fill. Maybe you have a target towards, let's use for example, improving health outcomes for whatever population that you're working at, and you have to get the right people to fill in that job so that your health target gets met. Some of the things you're going to be thinking towards is who is the people in your target population that you're trying to move. For example, if your target population are the aged, or people of geriatric age, you're going to be looking for people who have good experience or good skills as regards chronic conditions and comorbidities, and dealing with geriatric patients. And of course you need to know in terms of what resources do you have and how should those resources be used, and where should a majority of those resources be focused on. For instance, if your population are people, maybe cancer patients, the kind of workforce you're going to be recruiting, the kind of skills you're going to be requiring of your workforce is going to be quite different from if you have a family medicine or pediatric focused kind of service, because your population health strategy is going to differ based off on whatever it is that you're trying to achieve, and therefore who you recruit, what kind of skills that they have is going to need to align with your population health strategy. So that's where you get into the bit of identifying what competencies that are required for the role that you're trying to fill. And with competencies, you'll be looking in terms of what kind of knowledge do the people, the person or the people you're trying to, what the roles are going to do, what kind of knowledge are they expected to have, what kind of skills are they expected to demonstrate, what kind of behaviors are they expected to exhibit. And then, of course, you're going to get into identifying what your outcomes and performance are about. You need to at least have some sort of a set of outcomes in terms of, for instance, if you have an outcome, you want to make sure that the knowledge, skills, and behavior of whoever you're trying to fill a job aligns with what those those performance expectations or outcomes are, because it does help you in knowing whether this person is going to be able to achieve those outcomes, or this person be able to achieve what those performance goals are. So those are some very important things to consider when it comes to filling out a role. So then with workforce development, we are it's not just only in terms of the person who is being recruited. We also have to think in terms of the person who is already in the organization. Maybe you are either going to have them fill a role that they have not filled before, and or you are trying to make them do more work than they used to do before, kind of expanding what their responsibilities are. So there are key domains you need to consider in terms of the knowledge and the skills, especially when it relates with population health practitioners. You are looking in terms of the person's knowledge and skills about the healthcare system, and the knowledge and skills about the legal side of things, the regulatory side of things, the administrative side of things in terms of the laws and the ethics, the code of conduct, and stuff like that. You are also going to be looking at their understanding of the social, behavioral, and environmental factors that affects health, the social determinants of health, or the ecological determinants of health that we have already discussed in this module. And you are also going to be looking at their analytics abilities, not just in, you know, not everybody is going to be the analyst, the expert in doing all the statistical analysis, but there's a degree of being able to interpret an analysis or analytical results that is required from every population health specialist or population health professional. So being able to look at data, know how to interpret it, is a skill and knowledge that is very critical for population health professionals. And then having an understanding of processes and designs, this becomes a lot more critical when you are looking in terms of middle management, top management roles and responsibilities, because in this case you're going to be doing some major decision making, and be having a good understanding of processes and designs is comes in very, very critically. And then you have to have some form of interpersonal skills. And this both comes in enhanced communication and in collaboration with dealing with different interprofessional competencies and interprofessional goals. There's been a lot of push towards interprofessional teamwork, and because it is in working in this interprofessional teamwork, you're able to rely or interface with the people with different types of training that can be quite different, that can be quite very, very different from your own training, but somehow because you're having to work together, you're going to have to find a way to communicate with each other, and that really does help in building your interpersonal skills. So, having identified what those um, key knowledge and skills that it's required of a population health specialist, you then want to look into workforce development. So it could be that the people you have some of those skills, and they just need a bit more training or a bit more motivation to be able to do more. Then you want to kind of go into thinking, what type of development plan do we want to come up with to help them achieve that? Or it could be that you feel that maybe it's going to be better to recruit someone from outside rather than building from inside. Depending on whatever what your strategy are, you could, that would determine whether you are going to be developing in-house, or your development is going to come from, recruiting from outside. But either ways, it does help you in determining what it is that you need to be looking at. And then that comes in, coming up what your strategies are for those development plans are. What are your workforce development strategies? What are the objectives that you are hoping for those plans to be? And what resources do you need to be able to achieve those objectives? So the workforce development plan, there are a couple of things you want to look into when it comes to what your development plan is going to be, whether you are going to be looking in terms of education, or in this case, you may be focusing a lot of trainings, either virtual or in person. You could be thinking in terms of exposure, or sometimes exposure can require shadowing someone doing another job, or having to, get kind of a work exchange or something like that. And then you're having performance support with what happened with COVID, where we had to very rapidly move online and get into digital everything. You can imagine that there was a lot of need for support staff, IT support staff, that probably there was not at that point. So an organization that had to very rapidly pivot towards digital health would have to get a lot of IT support staff in terms of that. So they would have to rapidly come up with a workforce development plan that is geared towards the performance of support, because you're not going to have a doctor also being an IT expert. You're going to have to need a lot of those external people to provide support for them to be able to do the job that they need to do. So, then we talk about organizational culture. Organizational culture, which you guys may already have heard about, organizational culture, basically what that does is it determines how an organization makes decisions. A lot of the time, the organizational culture determines what your population health strategies are, and what your the kind of performance goals or performance objective or strategies that you're going to be looking for. Also, in terms of what kind of skills and competencies you're going to be looking into when you are either recruiting new staff, or even coming up with a work development plan, because your organizational culture determines how people in the organization make decisions in terms of what do they consider to be important to them, what do they consider to be critical, of critical importance to them. And it characterizes the behavior that is the organization reinforces, or consistently demonstrates towards its staff and within its staff. And a lot of that is kind of shown in the way people interact and in the way people respond to change. I'm going to use an example of cultural competence. There are some organizations that really went into the idea of cultural competence a lot quicker than other organizations, and that had to do with their organizational culture. The organizational culture in those organizations were more open to new things. They were more open to new concepts. Some organizations, not so much. They're a little bit more traditional and not so quick to, going to new things. But organizational culture really does define the individual and collective behavior of the organization, and you can very easily tell, where someone is. Well, sometimes you can very easily tell, not all the time, where someone is coming from based off on their behavior, because of the kind of organizational culture that is where they're coming from. So, lastly, we are going to be talking about change management. So, with change management is basically strategies to create change that address the failure of the will and failure of execution. Say we have come up with a workforce development plan, and somehow things didn't quite work out in the way that we thought it's going to work out. So, but we have to do something about it because probably time, effort, money has been put in into coming up with this workforce development plan. What do we do about this? This is where the change management comes into. So there are a couple of framework for how to manage change. We have the first framework is switch. The second is psychology of change. The third is the Nota 8 stage change model. So I'm not going to go over this framework one after the other. I'm going to pick some elements of each of them to talk about, and then I can refer you to where those strategies, where they are, which framework that they are coming from. So we the switch. I just really want to talk a little bit about switch. One of the things that is characteristics of switch is in this the key behavior change pattern of it, whereby it kind of tries to demonstrate how change happens by using the analogy of people are riders on an elephant that is traveling down a path, whereby the riders are things like the data, the evidence, and then you have the elephant being our unconscious choices and our emotional needs, and then the pathway being how we go from where we are to where we want to be. So that would be the pathway. And the three keys to behavior change being direct the rider, motivate the elephant, and change the path. So that is the key thing about the switch framework. So with the motivate the elephant, we are kind of thinking in terms of creating change that comes by, how do we get our emotions to kind of align with where it is that we want to be. And things like sharing stories has been one of them, and making change joyful, meaningful, easy, and trying to get people to connect the changes to the purposes that they have. So there are a couple of tools that kind of goes within that way. One of the tools thinks about aligning expectation with degree of control, as you can see in this image, whereby the where we want to be is passionate champions, having our people, the healthcare professionals, being passionate champions of the public health strategy that we're trying to effect, and that has to do with getting them to feel having this high expectation of there's something to be gained by achieving the strategies, and also getting them to be in a position where they feel that they are the ones who are initiating the change. And then we have the identify source of resistance. This comes from the philosophy of change. So with the identify source of resistance, we're kind of looking in terms of confidence one has in making changes and trying to align it with the importance that has towards getting those changes made, with the goal being to decrease the resistance that people have towards getting things to change, because they don't want it to be, oh, this is taking too long. They want it to be like, oh, I'm ready, I'm willing, I'm ready to get this to change. We want people to be at sea. When you are at sea, there is a high confidence, and there is they consider the change to be of high importance. So that's where we want to be. And then we have the shape the path, which is under switch, and create agency, which is under philosophy of change. You can just pause at this point and kind of read through to here read out what that happened. A key thing with the behavior, with the philosophy of change, is agency, trying to create agency. And agency is more or less like someone owning the change that we want to see happen. And this is where you have them kind of trying to initiate the change because they feel there's a confidence in the fact that I want to have this change. I can see this change happen. I know how to get this change to happen. That is where kind of agency comes in, and its agency goes hand in hand with power, and the ability to act with purpose is something that is very very important when it comes to managing change. And then we have the uh, Kota, I think it's called Kota. I'm not sure if I'm pronouncing it right. The four eight-step change. So this module or this strategy here is combining that with the switch. So you have create a sense of urgency. Says put that with this elephant. The switch is saying if you're trying to create a sense of urgency, focus on the elephant. If you're trying to, build a guiding coalition, focus on both the rider and the elephant. You're trying to form strategic vision and initiative, focus on rider and path. And if you're trying to enlist volunteer army, focus on elephants. You are trying to enable action by removing the barriers, focus on path. If you want to generate a short-term win, focus on elephant and rider. So whatever it is that you're trying to do is kind of telling you this is where to focus on to get the most out of what it is that you are trying to achieve. So that is where we end for today's module. Do remember to use the Q&A board for questions, and I will see you next time. Bye.